everyone. It's really, really strange this morning to be actually in a room with a room full of people for one of our strategy events. And I've become so used to staring at the camera directly and trying to sit serious and speaking to everyone. Today's session, we're really, really delighted to be here in the Spine, Europe's healthiest building and the future home of the Pandemic Institution. Health and inequality is probably one of the most pertinent issues affecting our society at the moment. It's 1/6 of the Liverpool City plan, but actually its importance goes well beyond that. And the panel this morning, moderated by Colin, is going to talk through some of the key issues. I think from a business perspective, what we've come to understand is the impact that health and health inequality has on the talent that we can attract, the talent we can utilise, our productivity, and our health and well-being of our staff, colleagues, and indeed customers. There's also a fantastic opportunity as Liverpool and Liverpool City Region to use health as a real catalyst of our economic growth over the coming years as we look at economic recovery from the last 18 months of COVID and beyond. I'm sure Colin, who's been at the forefront and the vanguard of that particular drive, will focus upon some of those issues shortly. So look, thank you very much for coming this morning. I'm sure you'll enjoy the debate that's about to take place. Really appreciate your input as well. Lots of questions, lots of comments. That enables us to form a really interesting view about how businesses can contribute in the area of overcoming health inequality in our city and city region. Colin, I'll pass over to you to moderate today's session. Thanks.
I normally stand up to talk, but I'll stay sat down because it probably projects, it causes less aerosol projection. It's brilliant to be here, you know, and many of you all know the journey that we've been on as a city to create this building. You know, you're now sat in one of the world's healthiest buildings. It's rated platinum, well standard. There's nothing else like it that we're aware of in the country. It's here in Liverpool. It's also got some of the best views of any city in the world. And if you haven't had a chance to look at them, then I'm sure the RCP team won't mind if, when you go out, you go into their lovely restaurant space Axis and look out of those windows, because we do live in an amazing city and you get that panoramic view of it from here. But we've got a fairly serious topic today, and just yesterday I was talking to Tony Reeves, who's Chief Exec of the City Council, about how important it is to use the knowledge economy to drive forward Liverpool's recovery and to be really optimistic about the future of the city and the city region, but to be honest as well. And if we're being really honest with ourselves, we live in a city with some of the worst health inequalities in the country, which I'm sure the panel will agree have been exacerbated by the pandemic. It seems to be the poorest areas which suffer the most when you get into any kind of an economic and health crisis. So and we've got a great panel today. I'm going to introduce each of you now, and then we're going to use the time between now and 11 o'clock to hear from the panel and hear from you as well as to what we can do to innovate here in Liverpool and be at the front of it. We've launched the Pandemic Institute here in Liverpool in the last few weeks. That's innovation. What else can we do? So I'm going to start on my left here with Professor Cheng Hock To, who is from the RCP and obviously Liverpool University Hospital. Then next we have Emma Lord. First time I've met you today, Emma, and really excited to hear all about capacity and the work that you do. Nice to know you're in Queen's Buildings as well, because when I was with Bruntwood, that was one of our spaces. Claire Liddy, oh sorry, I've just jumped Janine there, so Janine will go with you next. Janine has an incredibly important job, particularly in today's topic, because cancer is going to be one of the big things that we're going to talk about here and the effects of the pandemic on cancer. So Janine is Centre Manager for the incredible Rutherford Cancer Centre building, which is just behind us. So I'm sure you'll be able to see that out of one of the windows.
Windows this side next time, please.
that way, isn't it? Yeah. And I think if those blinds were open,
yes,
we would
yes,
see
you
your building, wouldn't we? And then, so Paul, you've already met. So last but not least, Claire, who I know Claire very well, and probably one of the biggest champions of innovation in the city region. Claire heads up Alderhay Innovation Centre, and having been around Alderhay, I don't know how many of you have been to to Alder Hey or even seen the innovation centre there. But I think it's one of the greatest things that we have as a city and city region, so it'd be really good to hear from Claire. But I think, firstly, let's go to each of you down the line and just get a view on, where we are at in terms of health inequalities. And then we'll go into some questions about how we can start to fix that. So we're in the incredible RCP building here. What are the RCP going to do to tackle health inequalities, not just in Liverpool, but across the country? And what does the future look like?
Thank you, Colin and Paul. And good morning, everyone. For me, it's such a privilege to be here and sort of talking on behalf of, this 500-year-plus old organization, which is the Royal College of Physicians. So when you think of an organization that has its roots in the days of Henry VIII, what does it do in this 21st century? Of course, our mission statement is very much to always improve health and care. But in 21st century England and the world, the challenges are different from what they were back in those times. So around 2016, the dates of which I'm fuzzy about, the then president of the college felt that we needed to be much more outward-looking. Not to say that we haven't been. It's a global organization, members everywhere around the world. But it has always been felt that it was a London-centric organization, and the membership in the North felt that it didn't have the opportunities to engage with the college as it should do. So this bold move to have a second base outside London for the college, and I'm certainly very pleased that Liverpool was the city that was chosen. So then the kind of crunch comes about what we do. We can all obviously do more of the same business that we do in London, but it seemed a missed opportunity. We don't, offer more. And clearly, to me and to many others, the fact that it was going to be in the Northwest, in Liverpool specifically, you have to do business where you are sited. And it's almost, really straightforward to think, well, what are the health issues of this area? And even before the pandemic, health inequalities was very much high on that map. And, if you look at figures of the top 10 town councils, city councils, with the lowest life expectancy for men, out of the top 10, 9 were in the north, and 6 are in the northwest. Liverpool, Knowsley, all the areas that we're familiar with. So it's really imperative that the College of Physicians must do business in that area. And quite clearly, it isn't one organization that can deal with it, or even one city council, one business organization. It really has to be a collaborative, joined-up effort. So we're in here to do that business, to connect. And nationally, the college has spurred the establishment of the Institute of Health Inequality Alliance. So at the moment, it's a kind of loose connection of people who are signed up to it, but we're hoping that generates the momentum to take things forward. And if I'm not mistaken, Liverpool City Council has also joined up as a partner. So we see this as a journey together. The fact that we're here locally, next door to everybody else, means that a key strategic angle of the RCP at the spine is to work with its local community, but also across the north, with areas like the health tech clusters in Daresbury, but further through to the kind of northeast region. So we think the leveling up white paper will be important. We obviously want to hear the details, but it's also for us to find solutions. And RCP is here in Liverpool to be one of those partners to figure out what best to do, certainly for Liverpool, certainly for the North, and then for the country.
Well, it's absolutely brilliant to have you and your colleagues here in Liverpool, and I think the iconic nature of this building is a great symbol, isn't it, for what you can achieve?
Yeah, it was all planned before pandemic, but as it turned out, as you highlighted, this kind of building is just perfect, really, for the post-pandemic world in terms of promoting health, but also, in an area where we're not far from some of the worst sort of life expectancy. When I travelled to London quite frequently, when I arrive in Euston, from Liverpool, Lime Street, there's a 10-year difference in life expectancy. So it's jarring, really, and a college which has 2 bases can't be seen to be, not in this area of work.
Absolutely. Emma, I'm fascinated to hear a bit more about capacity and what you do, but I'd also like to pick up on your thoughts on what Cheng Hock has said there. How can we really build on collaboration and partnership and make that a USP for Liverpool going forward in tackling health inequalities?
Sure. So capacity as an organisation is really tricky to explain, and if our comms and marketing team were in the room, I'd get shot for it. So I'm not going to give you our official blurb, but please look on our website, and if you see the comms and marketing team, tell them I said it. But broadly, we help public services and voluntary organisations unpick really knotty problems, of which there are a lot at the moment. So we work kind of primarily across health, social care, both children and adults, and the third sector, to help brilliant organisations do more brilliant things. So that's who we are as an organisation. In terms of a response to your question, how do we kind of look beyond the headlines of these health inequalities that become harder and harder to listen to, despite being said every day. And I think we chatted earlier that there was a headline this morning that it'll take 10 years for us to catch up with the impact on treating cancer. There'll be more and more of those to follow. I think strategy has a role to play in this, but actually where we've seen the best impact is when local action has happened, and that's what's got us through the pandemic. It's not been kind of important people sat around a table thinking about how we're going to do this. It's been local people who know their communities and understand their people responding and getting on and doing. So a big thing that we try and do at Capacity is to really understand the problem. So the data is massively intelligent, but it can only tell us so much. We need to go and listen more to people who are living with this inequality to understand what isn't working, what's really not working. The headline might be poverty, but what is it that's sitting underneath that? And then how can we try and unpick some of that? And to your point, no one agency or one person can do that. It's about people coming together to create a shared purpose and shared vision, but really try and get to the nub of the problem. And that's much easier said than done, because there's so many layers, especially when it's so entrenched in a city like this. Flipping that on the other side, let's not take away the optimism and the amazing achievements that have happened during the pandemic. Let's keep hold of that and not get beaten down by the horrific headlines of that health inequality is throwing at us all the time. So for me, it's keeping hold of the optimism and the can-do, but really, we've all got a role to play in really listening and to try and understand that problem before we kind of dive in feet first with a strategy or a framework or something like that.
Yeah, absolutely. And Janine, picking up on those comments, you've got an extensive background in the health sector, and I know you worked at Spire before Rutherford. So, you've kind of seen how the private sector has worked. How can we try and bring together in the kind of way that Emma has described, these brilliant private sector facilities like Rutherford, that will be, I think, probably one of the first 4 or 5 proton beam cancer treatment centres in the UK. How can we create a unique position in Liverpool where we've got those private assets and we've also got the NHS Trust here working together, coming together through Liverpool Health Partners, working with the RCP? How do we turn that into one ecosystem that tackles these health inequalities?
That's a great question, Colin, and something that there isn't an easy solution to.
Yeah.
Yes, we've got a fantastic facility, and I'm absolutely privileged and honoured. But at the moment, it is a private facility. I'm from Liverpool. What I would be my ultimate dream and passion, as is our CEO, who's also from Liverpool as well, for Joe Bloggs on the street to be able to access proton beam therapy. In the centre, we've got an MR Linux machine, proton beam therapy, and as Colin's just outlined, there are not very many of them in the UK, but a huge game changer in cancer, particularly for paediatric patients. Now, I know the NHS have got a model for proton beam therapy. They've got the London site and also in Christie's, which is pretty phenomenal. When we look at the stats, and yes, they are scary headlines, but they are reality, it doesn't scratch the surface. I have got an empty cancer centre over there. Well, when I say empty, we've got capacity over there for patients. So we would welcome and open our doors and embrace that to happen. I know there have been a lot of discussions at a very, very high level with NHS England and everything else, which is a huge conversation, which I'm not privy to a lot of. But that is my ultimate passion, to have that cancer centre here on this site in the centre of Liverpool and welcome those people who can't afford to have private healthcare insurance, or they don't get it through their employment. They can't self-fund, you know, so that's my ultimate dream, as I'm sure everybody else is. But it's not an easy answer to be able to do that, unfortunately, down to politics and everything else. But I know it's something we're very, very keen to work on and move forward with.
Yeah, absolutely. And it is great to have you here, have Rutherford Cancer Centre here at Paddington, and part of the Knowledge Quarter community in this part of Liverpool. So, you know, I think the more we can do to work together,
Agreed.
And the better going forward. I think that's absolutely vital. You know, and I think some of the people in the room probably know my stupid hobby for endurance sports, and this notion I have in my head that nothing is impossible if you put your mind to it. You know, it's amazing what you can do, but you know, I think you achieve the most in life through collaboration, partnership, and innovation, and that leads us nicely into Claire, Claire, you have to be one of the greatest campaigners for innovation in the NHS, and you know, such brilliant things coming out of such an amazing hospital at Alder Hey. So, you know, we have these health inequalities. I think there's a report saying that children's mental health is going to be really badly hit by everything that we've all gone through in the last couple of years. So what do we do, Claire? How do we use innovation to get out of this?
Yeah, thank you, Colin. Yeah, it's an area of passion of mine, so I'm, you know, delighted to share my thoughts today. You know, Alder Hey is an amazing children's hospital, and we're so lucky in Liverpool. I'm from Liverpool too, born and bred. You know, I went to university here, I live here, you know, I work here. You know, Liverpool is who I am. You know, but Alder Hey, you know, it is one of the world's best children's hospitals. And do you know why it's one of the world's best children's hospitals? It's because this city, Liverpool, has always had poverty, and poverty creates disease. And that has meant the children's hospital has brought the best doctors to the city, because there is so many children in this city suffering from disease, and disease is caused by health inequalities. So for Alder Hey, you know, for 100 years, we've been here. We started as a workhouse. Now we've got what is one of the most iconic hospitals in the world. And for 100 years, we've been innovating some of the, you know, the world-class treatments, such as in neonatal surgery, cardiac surgery, antibiotics in children came from Alder Hey. We invented them. So innovation is not new to Alder Hey. But what is new is we have the Innovation Centre, which is what I lead on. I'm part of the executive team at Alder Hey. But our new innovation strategy is all about how we're going to use technology, work with industry, tech giants, startup companies, entrepreneurs, to bring technology into healthcare to tackle health inequalities for children and young people. I just couldn't believe the statistics when I read them about this city where I live. You know, from the top end of the city to the bottom end of the city where I live, life expectancy for children and young people is 20 years different. There's places in this city, in Liverpool, where life expectancy is worse than in Kenya. You know, for me, when I read that, and I only learned these statistics actually over the last 12 months because of the pandemic has really caused us to think differently. the data that we're seeing, around mental health, Colin mentions mental health in children and young people, our referrals are up 50% compared to pre-pandemic. We established a crisis service, which is a 24/7 service for children who need help with mental health issues just before the pandemic. That is 50% higher, the referrals that are coming through that service than before. There really is, a need to act. But in terms of coming back to innovation, we are starting to use innovation now to tackle health inequalities. I'll give you just 2 examples. I could give you 20, but 2 examples that we've done recently, and it's too early to know the impact because we've been developing these technologies during the pandemic. What we decided to do during the really hard times of the pandemic in Alder Hey was not to shut down our innovation service. We felt actually, the wrong thing would be to shut down the service and repurpose the staff to help on other areas. We said, no, actually now is the time to accelerate our innovation service. So one of the activities that we've been able to deploy in August is a brand new platform. It's a digital therapeutics platform for all the children and young people have got access to it now across Liverpool and Sefton, and it brings together a service that was once 9 services to one digital front door, so children and young people can self-refer, they can access self-care, they can be empowered to learn about what they're worried about and to hopefully not require admission or referral onwards to see a mental health practitioner. And that's been really, really successful. Our referrals through that brand new service, it was only launched in August, have gone up a huge amount. We haven't been able to measure the impact yet, but that's just an example of how technology, about our innovation is giving children and young people in this city different options to help with their mental illness. Another example I'll share with you, and again, this is one that we've been working on for 3 years, and it was only with the pandemic that we realised actually it's an AI, an artificial intelligence, and what it does is it looks at patients' records, it looks at their demographics, where they live, all different markers in their medical record, and it looks for children and young people who are highly unlikely to be brought to their appointment because probably their parents have not brought them to their appointment because of other issues that are going on in their family life. It might be inability to come because of they can't leave work, because they can't lose their income because they're on 0-hour contracts. It might be because their parents are suffering from conditions with alcohol or substance abuse. But we know that out of all of the children who do not get brought to Alder Hey for their attendance, 50% of them children are living in a situation of health inequalities. So what we've done is put an AI, an artificial intelligence in, which now preemptively looks for them children and intervenes before the appointment. And we have a healthcare worker or somebody from the council who will look out to that family and encourage them to come and ask them preemptively to come to their attendance, or we put a different intervention in place. So they're just a couple of examples. I hope maybe that brings to life how technology and innovation can really help tackle healthcare inequalities.
I mean, that people missing those appointments to bring the children to the hospital, has a devastating impact, doesn't it? Both, not only most importantly on the children and their lives, but on the resource of the NHS as well. So I think that's a great story. Paul, you've revitalised the Chamber. Liverpool Chamber, I think, of a different thing since you came into play, and you're really helping to put Liverpool at the front of the policy agenda as well as looking after your members. So in terms of levelling up and health inequality, every member of this panel has had a great story about collaboration, partnership, innovation. How do we push that forward in policy terms?
I think it's important that we create the levers to recognise that health doesn't sit in a silo. If you look at the statistics, the demographics and the data around some of our challenges in our city and city region, there's an incredible coalescence of health inequality with poverty, with worklessness, with persistent absence and exclusions from school, criminality. You can see all that. There's an amazing set of data that is there. And what we need to recognise in policy terms is how do we bring that together so that macroeconomic policy isn't happening at 30,000 feet. It's actually being informed properly by the lived experience. It's something Emma made reference to. How do you actually create the insight that you need to create policy interventions that help people? And from a business perspective, what do we want? We want a healthy, productive labour force within our city and city region, the best and the brightest talent that we can possibly generate from as was said before, you know, in the green room, you know, almost from neonatal right the way through to create those conditions where every single individual who is, you know, born and raised in Liverpool has the opportunity to develop a fantastic career within our overall workforce. That's taking a very economic-centric view of it. So it's recognising that policy can't happen at 30,000 feet. It has to recognise that these are people and there are systems in place that aren't quite conducive to joining some of these things up, as I say, the multitude of elements, of which health inequality is one element. The other point I'd make, Colin, as well, not just from a policy perspective, it's also recognising some of the innovation that takes place within the private sector in Liverpool. You know, we've got two of our members who are sat next to each other there, you know, Paul from Medicash, Gavin from Mashbo, both of whom within their own individual businesses have got some outstanding opportunities for both their staff and also their customers around how they can improve the health outcomes for their own staff. So there are solutions from different areas, the solutions from the public sector. There are also solutions from and within the private sector as well. And we need to be encouraging almost that inbuilt innovation within private sector businesses to contribute to the overall outcomes that we want. It's not just a public policy challenge and solution to be found. The solutions can also be contributed to from members of the private sector as well. And I'm sure there are others in the room as well.
That's a really good point. I'm going to put a question to the panel on that shortly. But just before I do that, it would be great to get some questions from the audience as well. So if you can have a think about what you want to ask our panel, I'll put a question to them next, and then please just put your hand up and we'll get some questions, because you know you've made the effort to get here early on a Friday morning. So make sure you use the opportunity to ask our panelists some questions. But picking up on Paul's point, and Paul, if you'd come back to this after the panel, you know, see, a lot of what we're doing here in the Knowledge Quarter and through our development arm, Scientech, is creating the places, spaces for business innovation. And that interaction, you know, Claire has talked about it, between, you know, world-leading hospital and the private sector and innovation, that interaction that probably only really comes when you put great academics together with great clinicians and entrepreneurs. How do we use that to tackle the health inequality issue? I mean, Chen Holt, you know, you've got RCP have some fantastic links into the private sector, some great benefactors. How do we get business more involved in this agenda?
I think what I've learned from being at the college is that the college name is important, in part maybe because of the 500-year history and the achievements through those times. And I think we can punch our weight, certainly in bringing people together. So the power of convening is often underestimated. And I think when we're talking about finding solutions that involve many, many stakeholders, you know, I think we as a college must certainly work very hard to make it happen. So we're open to suggestions. Our relationships with benefactors have probably been slightly perhaps old-fashioned when you look at it now, and I think there are opportunities that we would be keen to explore now that we are in Liverpool, you know, new ways of doing business. And I think living in this 21st century post-pandemic, it's pretty clear that we all need to work better together. And there are easier ways to do so. It's just making sure that we have the time and that investment in opportunities.
Yeah, I completely agree with that. I think, you know, the RCP can innovate here perhaps in a way that you wouldn't have thought of in London, and there is a culture of partnership in Liverpool, and it would be great to. I think we're already seeing a fair amount of innovation from the RCP, even though the building's only just opened. And, you know, Emma, you know, the role of the private sector business, that's vital, isn't it?
Absolutely, and I think what we often overlook as employers is the impact that we can have on our workforce. So, kind of two thoughts really, how can we incentivise health as an employer? And there's loads of different schemes and things out there, but, again, drilling it back down to the basics, how can we encourage that? And I think, the second thing, kind of relating to the first conversation, poverty is at the root of a lot of this inequality. So as employers, how can we employ and support our employees through more diverse recruitment? How can we be more supportive employees, both to enable them to access employment, but then also to retain employment as and when life gets trickier. So, we've all felt the pressure of the past 18 months, some pre that, some post that. We don't know what the future's going to look like, but to be a supportive employer is massive in terms of being able to try and reduce some of those health inequalities. So what role can we play as employers, colleagues, to support people to stay healthy and well in work?
Yes, that is critical, isn't it? And, we're in strange times, aren't we? The number of people I know whose children are off school at the moment with positive tests and whose family members have got it. And, we are still living in the middle of the pandemic. It's not over at the moment. So, does that makes things difficult for you, Janine, doesn't it? I guess that you're running a private business in a pandemic. How do you think we'll get through this period? Are you running at full capacity now?
What we've done is we've gone back into the centre because due to the vulnerability of our patients, we've gone into just key and essential staff being in the centre again now. So it's really lucky that I'm here today because we have taken that decision. With the nature of our business and what we do, using Protons, our staff are very specialised, so keeping them safe and protecting the staff as much as possible. It's certainly been very challenging opening a new cancer centre in a pandemic, and it's made us a lot more creative, particularly with recruitment and things as well. We've got some guys which we call HCPs, who basically take everybody's temperature on the door. As it happens, by coincidence, the 3 ex-military guys, all young guys, all Scousers, all very, very cool, just dying for that opportunity and that break. So what we've done is sort of looked at how we can grow, develop those people as well. So we're just launching an academy within Rutherford as well to be able to assist those. And they came on as sort of temporary agency workers, and 2 of them have now got permanent jobs, with a few of them all to get permanent jobs as well, one being a healthcare assistant, one being an admin as well. So it's giving new opportunity and creating those new things. But that's just a very small example of what the academy can actually do there to help with that.
Yeah, really important work. And Claire, we pointed out we've got colleagues in the audience who are on what I would call the creative digital side of health tech and health innovation. And Liverpool has clearly huge strengths in that area. I've been to your innovation centre. There is a strong, what I would call, digital tech, health tech presence. Do you see that as being a USP for the city region going forward?
I do. I think we need to focus and build on our strengths rather than trying to, create a new wheel. And I think if we look at the city, starting right from kind of, the education sector, the university, we have huge strengths in computer science and data and AI in our university. And we have strengths in our, in our digital creative sector in terms of businesses and startups. But we also have strengths in Daresbury. We're so lucky in the Northwest to have, the National Centre for Data Innovation, which is the Hartree Centre, and that has a huge amount of public grant money, which we can leverage to solve problems. I think for me, what we should be focusing on as a city is the biggest need. We should be focusing our attention, our efforts and our time and coming together as a multi-sector team on the biggest need. And the biggest need right here, right now is tackling the issues around health inequalities. And for me, data is a big strength for the city. We're one of the only cities who've had the investment into our civic data cooperative, which is forming now and is starting to move forward. But for Older Hay, as a hospital, where we're quite different actually in our thinking, because we have the innovation centre and we're allowed to think about the future and actually what's healthcare going to look like, not today and what the A&E is doing today, but also what actually is going to be happening in the health service in 5 and 10 years' time. And where we're at is actually artificial intelligence and how we use data and machines to augment and to enhance clinical decision making, to improve service, to preemptively intervene in deterioration or disease is where the health service is going. So for the city, there's a real opportunity, given all of the building blocks that we have already, to do something quite pivotal and to be known, I guess, globally as a city that has really driven forward that kind of digital innovation agenda.
Absolutely, on that. That's something that we're doing everything we can to champion. I think it's great that the Chamber have got this event here today for it. So I'm going to go to the audience for a question. One final point from you on this, Paul. So we've got businesses here in the room as well as colleagues from university and hospital and public sector. How do people engage with you in the Chamber to take this agenda forward? Can Liverpool Chamber be at the forefront of tackling health inequalities?
I think our role, Colin, is to convene businesses and understand the experiential frontline experience that they're having at the moment, and making sure that partners in education, public sector actually understand what is happening on the ground. And I think it's almost that conduit to the private sector that we can help provide through some of our policy work, through some of our research activity, and just through our day-to-day engagement with businesses, where we understand what is happening on the ground. And I think that's invaluable. I keep quoting you, Emma. Made the point really well before about you can only inform interventions and policy if you understand what's happening on the ground. And I feel the same way when it comes to how we talk about business and business engagement and what business is doing and what they need. So that's the way for me that we should be contributing to this, and being able to articulate to colleagues what businesses are doing at the moment. Hence why I know what Paul and Gavin's company in particular are doing at the moment. The final point as well, Colin, just in terms of the policy perspective and the interventions, I think there's a little bit of a consideration for us about how we instigate system change as well. Do we take a very focused area-based approach to pockets of extreme deprivation where some of these health inequalities are particularly challenging, where we're almost requiring a triage situation? Or because at the moment we've got these strategies and some of them are almost city region wide, and I think there's a challenge there in terms of how do we actually instigate meaningful change in areas where the data tells us there are particular challenges, and where some of those agglomeration of problems are emerging, predominantly in the north of the city, Speak Garston. You can see that from the data. These are hotspots where maybe some focused attention needs to go in. And from a policy perspective, I'd suggest that there maybe needs to be some sort of triage, short-term approach, which may or may not exist already, that involves the business community in those particular areas as well.
Absolutely. Right, so I did offer everybody the chance to put forward a question. We've still got 10 minutes or so left to do that. So if you want to ask a question, please put your hand up and say your name. And Gavin, you've been mentioned several times, Gavin, so you must tell people what you do.
Yes, I'm Gavin from Mashpro. We're a software development consultancy. So people come to us with problems and we work out how tech can solve that problem. And listening to everything that's been said, it's one of the things that I can think of is how do you get the brief to people like my team of just a small part of the problem? How can we create an MVP, a minimum viable product to test something? But with tech, you've also got inequality there as well. So some of the areas that you're talking about, people aren't going to have access to technology to engage with the things that we do. I'm working on an education project at the moment, and the biggest fear is the people that they really need to engage with it can't. And the games that you get the problem and you solve it. One of my biggest achievements of my business is we created a product called the Hub of Hope, which is the biggest database of mental health services in the whole of the UK. And that came to me because somebody had a lived experience. We heard the story, and the story touched us. It was because I've got experience with mental health myself and my family, and we invested in that. We actually more or less funded the whole project at the beginning. Now it's self-funded. It's they pay us our proper fees now because it's growing bigger and bigger. But how do we get that initial seed? How do we kind of go, right, how do we solve this problem? How do we hear the story? Because without hearing the story properly and not at a top table point of view, it's like the person lived it. How do you get that? And then the innovators go, this could be the problem solver. And it's not necessarily big tech. It's simple technology or simple solutions are actually the answer.
So, well, that's important. Sometimes the solutions are simple. So who in the panel would like to pick up on Gavin's comments there? Yep, Emma?
Great question. And I think what you've said really resonates with what happens at capacity. People come to us with a problem, and it's only 3 months down the line that you really start to understand what the real problem is. You know, what can happen? We've said we need to understand the problem. So we've also said that the data tells us speak Garston, the north of the city. So the simple thing is, let's go out and talk to those people. You know, how do we do that? There's a wealth of organisations that are working at a really micro level, at street level, that Paul will probably be able to connect you with. You know, there's also, you know, real great expertise to facilitate some of that community engagement. So let's go out and have that conversation and understand it and let that be the driver for the solution. I think, you know, you mentioned cash. You know, people's time isn't free. So, you know, how do we make sure that we can reimburse those people that are giving you the problems? They've probably got the solution as well. They just perhaps don't know how to connect the two things, but I'm sure your team and others will be able to kind of, you know, enable them and empower them to think through some of those solutions. So I think let's not overcomplicate that part of it. It is going out. You know, if the data is telling us this postcode is a massive problem and it's becoming a bigger problem year on year, let's go and talk to them. They'll be able to tell you what the real problem is, and they'll probably have some ideas about how to solve it.
Brilliant, thank you. Let's see, should we just take another question? And then if you want to pick up on that previous question as well in answering. So does anybody want to ask another one? Got time? Yep.
So Julie Johnson from Law Solicitors and also chair of the Culture and Commerce Liverpool Big Company. One of the schemes that Liverpool Big Company are helping with at the moment is the Change Programme, which is about homelessness. So my question is about how we help businesses to help the individuals who work for them so that they don't end up losing their job because of substance abuse and things like that and end up homeless. How can we preventative measures be put in early stages that businesses can access, and if we can help through a Liverpool Big Company with the Chamber, some sort of hub for businesses to go to where they can access help for their employees.
So it's a really good question, Julie. Who would like to pick up on that one? Shall I nominate? I think I'll nominate Cheng Kok To to pick up on that. So, you know, I know you were keen to answer the other question as well. So, you know, do you want to pick up really on how do we get a simple brief from the health sector to the private sector? And really, how do we pick up in terms of Julie's question?
Yeah, I don't think actually it's such an insolvable issue. You know, when you look at how you are a good employer, it isn't just about getting your employees to focus on the job at hand, but supporting them, creating the right environment for them. So it's very much a sort of social responsibility as well. And some of the things that, you know, I've been privileged to listen to, it is at the community level. It is about a coherent, engaged group of businesses that want to share knowledge and want to exchange information on how they support their staff. And equally, the RCP would want to do that. So I think it is about, you know, sometimes simple things, you know, like tackling obesity, you know, dealing with kind of the scenarios of poor quality food, poor quality air. And I don't know whether there is an opportunity, certainly in Liverpool or other areas where such problems exist, that each business has almost a social contract, you know, whether it's engagement with homeless health, whether it's engagement with air quality or along those lines, because all these kind of social determinants of health, including housing, they affect everybody. You know, often our employees don't tell us about it. You know, but it is about making sure that it is something that we want to discuss. There is a social responsibility and a civic responsibility to communities, like in Garston, picking up on the point that I'm sure is well made already. Sir Michael Marmot, who has the ear of government around health inequalities, was telling me that in his project he's sort of regarded as the expert in health inequalities, and he went to a community in Manchester, and one of the the ladies who lived there said, "Who are you to tell us you are the expert in health inequality? We live it, we know it, we are the ones who can help you with the solution." So I think there isn't a simple answer, but actually, when you look at it, there are simple things that we, perhaps as employers, can be doing. So it doesn't have to be overcomplicated. I think just showing social civic responsibility as an employer is important. And by the way, although I sit here with an RCP and university cap on, I'm not a million miles away from business. I do direct an SME, so I understand the issues. But I think now is the moment that collectively, regardless of which sector you come from, that we do things in preventing, improving health through prevention, etc.
I'm conscious we are technically out of time now, and that was a brilliant summing up, really. I think that in answering Julie's question, you've really summed up the importance of this whole subject, and I think we could probably stay here for a lot longer and take a lot more questions, but I'm conscious you were told this was going to end at 11. I'm sure you've all got important things to get to, not least, the weekend isn't far away. So I'm going to thank all the panellists. I'm going to hand over to Paul in a minute for a final few words, and I'm going to suggest as well that when you leave, don't forget, you can chat to colleagues at the end, and when you go, take another look at the view if you haven't had a chance to do so. So, Paul, I'm going to hand back to you now. Brilliant event, and thank you very much for inviting us to be involved, and thank you to the panellists as well.
Yeah, thanks, Colin, and thanks, panellists, as well, and thanks also to the audience as well. I'm sure colleagues will be able to stay behind afterwards if anyone would like to pick up some of the conversations that have been talked about. I think, from my perspective, where we stand on this, we recognise that, and Julie, your question really summed up the nub of this for a lot of particularly SME organisations, and I think there is a challenge there to make sure that we have some great employers here who recognise both the moral, you talked about civic responsibility, the moral and the economic arguments here. It's very similar to some of the conversations we'll undoubtedly have over the next couple of months when we're talking about net zero, about what compels businesses to play their part to address some of these massive social challenges that we all face. We have some outstanding people on the panel here who represent organisations in the public and the private sector, and particularly the voluntary sector. The private sector also needs to contribute that, whether it's through their own innovative activities to help find solutions, or whether it's through their own practices to ensure that their staff are well looked after. That drives talent recruitment, that drives talent retention, development, and ultimately helps solve preemptively, I would argue, some of the challenges that emerge in our wider society. So, look, we'd really like to continue the conversation offline. We'd very much appreciate those who have got some experience around challenges they're facing with staff on an organisational level. As Julie's pointed out, where some of the support mechanisms may exist, how can we help identify some of them as well and signpost you to them? Really appreciate your attendance today. Once again, Colin, thank you so much for moderating. We might have you back. And then also to the panel as well. Thank you so much for the insights you've provided us this morning. Our next sort of strategy event will take place, I think, on the 15th of October. Which will look at the net zero agenda and the built environment. So anyone who would like to join us for that will be very welcome. You'll get invitations to it. Thank you very much. Enjoy the weekend.
Thank you, everyone.